So while Britain rolls out its vaccines, Africa is still asking questions about access and availability. For more on this, we're now joined by Dr. Phiona Atuhebwe, the Africa Region New Vaccines Introduction Officer with the WHO. She joins us live now from Skype, via Skype rather, from Brazzaville. Doctor, of course, the UK has started its vaccination program, and the big question is, when can African nations hope to start getting and rather sending out COVID-19 vaccines across the continent?
Thank you very much. So we are dealing with two issues here. We have the vaccine availability. When will the vaccine come? But before the vaccine even comes, we need to be ready. So we have two parameters that we have to consider. The earliest possible date for the supply to step on our continent would be January 2021. But shall we be ready for it? That's a different issue, because as you saw in the recent past, we are monitoring the readiness in the region, and overall the readiness in the African region is at 35%, way below the requirement, which is about 80% for the vaccines to be given out, for countries to say they're ready to give out these vaccines. So the earliest date we are looking at is Q1 of 2021. Chances we could get the first minimal doses in the Q1, but the highest chance is that most of the doses, about 75% of the doses that we require, will come in mid-2021.
So still quite a wait then for African countries, but there are other concerns following the arrival of the vaccines. In the UK, we've seen that the government is floating the bill. That's, of course, through their National Health Service, or the NHS. What do we expect to see happen with African governments? Is there any plan to subsidize vaccines for poorer nations on the continent?
Yes. So that is one of the best things that has happened to us. And this is the COVAX facility that is collated by WHO, Gavi, and CEPI, where we have had the pooled demand and pooled supply. And for all African countries, the 54 of them have joined the COVAX facility. And what does this mean for us? That for the first 20% of the population, the vaccines that will come for the first 20% of the population of each country will be fully paid for by the COVAX facility. So for the first high priority groups in each country, with the first number of doses, limited doses we shall have, these will be fully covered. Unless a country wants to vaccinate much more than that, that is when the country will start paying. Even then, they will use negotiated rates, negotiations that have been done by the COVAX facility. So yes, the poor countries, as the poor countries, will receive vaccine for 20% of our population, free of charge.
And Doctor, the US president is issuing an executive order that would make American vaccine makers prioritize supplying America first. How do you see this impacting, supply and demand and vaccine deliveries to other parts of the world, such as Africa?
Yeah, that's a tricky one. But we have had these negotiations with the manufacturers. So we have had the deals that have already been agreed upon by some of them, with some of the manufacturers, negotiations that are going on with other manufacturers, and forecasts that we have from what other manufacturers have told us that they can be able to give us. So we still hope that we can be able to meet at least 1.8 to 2 billion. Really, because the COVAX facility was looking at 2 billion doses for all the members of the COVAX facility by the end of 2021. So with what the agreements and forecasts that we've made, the deals that we've made with the manufacturers, we hope that we shall not be affected, but that cannot be totally ruled out.
All right, thank you so much, Dr. Phiona Atuhebwe. That was very informative indeed. Of course, she is the Africa Region New Vaccines Introduction Officer at the WHO.